Now, a week and a half into the rollout of a COVID vaccine for kids ages 5 to 11, and thousands here in Indiana have already gotten their first dose.
Statewide, we are looking at about 8,700 first doses given. About 800 of those are right here in Marion County. The initial rush to get the shot left some vaccination sites without enough doses to go around.
So our Lauren Kostick tells us what parents need to know.
After more than a week, some health departments are running low on the pediatric vaccine.
This is a special refrigerator. That's a freezer.
And others are completely out.
6? Okay.
Health officials in Madison and Boone counties confirmed earlier this week they used up the last doses for kids 5 to 11 and are now advising parents to find clinics outside of their counties until they can get more in. And other health departments are also feeling the shortage. Hamilton County says their supply is very limited.
We had an initial allotment of 300 doses, which we went through very rapidly. We were able to get some additional doses from Indiana Department of Health, and by the time we closed down today, we should have given about 1,000 doses.
And on Monday, they expect another shipment to come in, but aren't sure how much. That's why they are only accepting kids that have appointments to make sure they have enough doses, and no one is turned away. 12
and up are eligible to do walk-ins. However, until we can get that supply of the pediatric vaccine up there, right now we're doing appointments only for that group.
With the vaccine supply being tight, Christian Walker suggests parents find appointments wherever they can.
It's going to take a little work on the parents' part to find those appointments, but if they can get them, by all means, grab that appointment and get those kiddos taken care of.
And on Thursday, Marion County health officials said they are not worried about their vaccine supply after opening a kids-only clinic on the west side.
So right now we seem to be okay with the supplies that are being provided to us.
To know whether a clinic offers the pediatric vaccine, look for the red marker on the state's map. You can also check if walk-in appointments are available. But remember, it's best to schedule one if you can.
Kostick reporting this morning. Now that kids can get COVID shots, a lot of families are hoping to finish up before the holidays, and clinics are opening just for kids throughout central Indiana.
But as you just heard, it might be harder to get one than you think. Riley Hospital for Children, for example, announced a new COVID vaccine for kids, a vaccine clinic for kids starting this weekend, though it's already booked up. There are 4 dates through December when kids ages 5 to 11 can get the pediatric vaccine. The one today and again on the 20th, and then December 4th and the 11th. Those dates are on your screen right now, but it looks like so far the earliest appointments are not until December 4th, and those could obviously fill up fast. Parents, remember, you need to make an appointment ahead of time, but you can check the state's website for any openings in case of a cancellation. The Marion County Health Department also just opened a kids clinic on the northwest side. It's on Commercial Drive. The clinic's open for 8 dates through December 2nd. The next one is set for Monday, 2 days from now.
And remember, parents, this vaccine is a 2-dose series. You're not considered fully vaccinated until 2 weeks after that final dose. So if you want your kids fully protected by Christmas, make sure they get their second shot by December 10th. That means you need the first shot within the next week.
It's a lot of information. If you want to look at it again, check it out and read it for yourself. We've got it online at WTHR.com.
Yeah.
Well, in January, larger businesses will likely be faced with making sure employees are vaccinated, or they could face a hefty fine. That is, if a federal appeals court allows the president's mandate to pass.
The president and CEO of one Indiana company talked with me about the decision to get all employees vaccinated, mandate or not.
United Way is among countless companies with at least 100 employees who could be tasked with getting everyone vaccinated. But long before this federal mandate, the nonprofit is requiring it to work here.
We had a lot of debate about it, and we decided that it was our responsibility as a leader in the community to help keep our community safe.
United Way of Central Indiana is the region's largest network of nonprofit agencies spanning 7 counties. It helps people living in poverty, struggling to make ends meet.
They are the most vulnerable people to both the health effects of COVID and to the economic effects of the pandemic. And so we wanted to set an example.
In September, the president announced plans to mandate vaccines for larger companies. Many employers like United Way impose their own mandate. President and CEO Ann Mertlow encouraged other nonprofits to do the same.
If you are not vaccinated or don't have an approved exemption by the end of the day on October 19th, you would not be employed at United Way of Central Indiana on October 20th.
The company has 104 employees. All but one are vaccinated. That employee has a valid religious or medical exemption.
And it's a very emotional issue.
As the January 4th vaccine deadline looms, Mertlow says she supports the community being a safe place for everyone.
I just think that there are times when organizations like ours have to step up and be first to set an example for the rest of the community, particularly given the people that we serve. And so that was really our goal in making an early move in this space.
A federal appeals court has ordered a temporary halt on the mandate. The White House is instructing businesses to move forward with the requirements despite the order.